Hi, I'm Dr. Sushma, consultant pediatric rheumatologist. It is my privilege today to speak to you about a condition that has vague symptoms and is called as pediatric Sjögren syndrome. It is a misunderstood and a under-recognized disease that is an autoimmune disease that can affect even young patients and rob them of the comfort of tears and a moist swallow. So, what is Sjögren syndrome? Sjögren syndrome is an autoimmune disease that is very well classically described among adults, especially middle-aged women, that cause symptoms called as sicca symptoms, that is dryness in the eye, dryness in the mouth, and may also affect internal organs. What is this autoimmunity? Our immune system is designed to protect us from external infections. But if it goes haywire, it can attack our own healthy tissues and cause problems. In Sjögren syndrome, it attacks organs that produce moisture, that is, the tear glands, the sweat glands, and so on. But as compared to adults, in children, the Zika symptoms may be subtle or even absent, and they may present with other manifestations, such as recurrent parotid swelling. Recurrent parotid swelling is the swelling of the salivary gland that is present in front of the cheek. Also, there can be arthralgia or arthritis, that is, joint pain, swelling, stiffness in the joint, or difficulty in movement. There can be fatigue or low energy, unexplained tiredness, and even rashes or kidney involvement as well. Also, there can be unexplained dental caries, even with good hygiene, or difficulty in eating hard food. Sometimes there can be systemic manifestations in the form of autoimmune hepatitis, that is, immune system attacking our liver and causing variety of manifestations, or cytopenias, that is, white blood cells, especially the lymphoid cells, being on the lower range. There can be involvement of the central nervous system as well. So, Sjögren syndrome in children is truly a master of disguise. So, pediatric Sjögren's, is it rare? If so, how? Let's look at not how Sjögren syndrome is rare among children, but about how often do we miss it. Because Sjögren syndrome is very insidious in onset, it is often missed. The recurrent parotid enlargement, that is, the swelling of the cheek, is often misdiagnosed as viral parotitis or mumps. And even the tiredness or the vague symptoms can be dismissed as just a tired child. So, high degree of clinical suspicion is very important to diagnose this Sjögren syndrome early on. So, if a child has recurrent parotid swelling or other symptoms of fatigue or arthritis, that is joint involvement, also has certain autoantibodies in the form of ANA or anti-nuclear antibodies, or something called as Rho or La antibodies, the SSA and the SSB autoantibodies, or if there is a family history of autoimmune diseases, we need to have a high degree of clinical suspicion to diagnose these children. And how do we diagnose it? How to diagnose pediatric Sjögren syndrome? Unlike adults, pediatric specific classification criteria are still evolving. So, established symptoms may not be present in children. So, what do we use is a combination of clinical, histopathological, and laboratory investigations. Clinical symptoms, as I told, there could be recurrent parotid swelling, Zika symptoms, and autoantibody presence, that is ANA, Rho, La antibodies. And sometimes when you see a rheumatoid factor being on very high titer, this could indicate a Sjögren syndrome. And tests for dryness in the eyes and dryness in the mouth, such as Schremer's test, tear breakup test, and many other tests. Along with that, unstimulated salivary flow test to look for dryness in the mouth. When indicated, we also do a test called histopathology of the uh, salivary glands of the lip, that is the lip biopsy. When indicated, we also do imaging tests such as ultrasound of the parotid gland and MRI xylography. And we need to remember that Sjögren syndrome can be primary or secondary. Secondary Sjögren syndrome is when it is associated with other diseases. For example, a juvenile arthritis or a systemic lupus erythematosus or even mixed connective tissue disorders. How do we manage pediatric Sjögren syndrome? Along with treating for the discomfort and preventing the damage and complications. So, how do we take care of the symptoms? So, treating the symptoms of dryness in the mouth and dryness in the eye with substitutes such as artificial tears and saliva substitutes becomes very important. Even maintaining a good dental hygiene along with fluoride application is also suggested. Depending on the organ involvement, if there is a systemic involvement, we also treat the child with a tablet called as hydroxychloroquine, which is comparatively safer in a long run, and also corticosteroids as a bridge therapy, and also other immunomodulatory therapies depending on the organ involvement. And we tailor the treatment plan according to the organ involvement in children. And complication prevention also depends on it. So, if a child has a recurrent parotid swelling or vague symptoms of arthralgia or arthritis or low energy, it is very important to think beyond the obvious reasons, that is Sjögren syndrome. Along with all of this, a psychological support is extremely important because these children suffer silently with the vague symptoms. And also, a fatigue can be really frustrating. So, even the other day, we had a child who did not come to us themselves, but child was brought to our OPD by a pediatric resident. The child, she was an adolescent girl who had multiple episodes being treated as multiple mumps. She had recurrent swelling in front of the cheek, and the child was being treated only as recurrent parotitis, as viral parotitis or mumps. But these recurrent episodes were not explained with only viral infection. Also, on asking, she was found to have low energy, generalized tiredness, and some aches and pains. On investigation, she was found to have these autoantibodies suggestive of Sjögren syndrome. And with treatment, these parotid swelling episodes and even the fatigue and the aches and pains are under control. So, thinking beyond the obvious when things are not fitting a diagnosis becomes very important, because children can be silently suffering through these symptoms when not recognized. So today is observed as World Sjögren Syndrome Day. And yes, even though it is rare, it can still happen in children. Because it is not very well understood, these symptoms can be missed, leading to late diagnosis and complications. And the theme for this year is raising awareness by research. This becomes possible only if we do a timely diagnosis of Sjögren syndrome by keeping all these symptoms in mind and referring to a pediatric rheumatologist when in doubt becomes very important. So, if your child or a child you know has any vague aches and pains, a positive autoantibodies, or a recurrent cheek swelling, dryness in the eyes, or gritty sensation or a foreign body sensation in the eyes, dryness in the mouth leading to multiple dental caries, or a poor oral hygiene, or difficulty in eating hard food, it is very important to see your doctor and visit a pediatric rheumatologist. Thank you.